Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How bronchitis inflammation affects breathing. Bronchitis is acute, sudden onset and temporary, or chronic, ongoing, inflammation of the bronchi. The bronchi are the large tubes that carry air from the trachea to the lungs. The inflammation triggers a cough that often produces mucus. /r/n/r/n Many people wonder if bronchitis is contagious. Technically, the answer is no. However, while bronchitis itself is not contagious, some of the viral or bacterial infections that cause it can be. /r/n/r/n This article explains bronchitis symptoms, treatment, when it is contagious, and when to see a healthcare provider. /r/n/r/nsimon 2579, Getty Imagesrnrn Acute and chronic bronchitis have the same symptoms, including /r/n/r/n with acute bronchitis. Symptoms usually resolve in 2 to 3 weeks. However, chronic bronchitis symptoms can last for months. Lung disease is usually the cause of chronic bronchitis. /r/n/r/n While acute bronchitis develops from respiratory illnesses, like a cold, the flu, or COVID-19, chronic bronchitis develops over time from chronic lung conditions. It is included in the umbrella term chronic obstructive pulmonary disease, COPD. /r/n/r/n Risk factors for developing chronic bronchitis include /r/n/r/n Bronchitis is inflammation of the bronchi, the large air tubes in the lungs. Pneumonia is inflammation of the small air sacs deep in the lungs, called alveoli. Although they are two different illnesses, each may have symptoms such as a cough and fever, and they may be caused by the same types of infectious organisms. /r/n/r/n How do you get rid of a bronchitis infection quickly? Home remedies for acute bronchitis include /r/n/r/n Bronchitis itself is not contagious, in that if you have bronchitis, you won't transmit bronchitis to another person. However, you can transmit some of the causes of bronchitis, which can produce a respiratory illness in another person. That illness may not progress to bronchitis. /r/n/r/n Viral infections are the most common cause of acute bronchitis. If bronchitis is caused by a viral infection, the viral infection that caused it can be passed to others. /r/n/r/n Some viruses that may lead to bronchitis include /r/n/r/n Bacteria are a less common cause of acute bronchitis, accounting for fewer than 1 in 20 cases. These bacteria can be transmitted to others and may cause a respiratory infection. Bacterial causes include /r/n/r/n Risk factors for noncontagious chronic bronchitis include /r/n/r/n The Centers for Disease Control and Prevention, CDC, advises seeking medical attention for acute bronchitis in the following situations: /r/n/r/n To diagnose bronchitis, a healthcare provider will take your medical history and symptoms and may order some tests. Common diagnostic tests include a viral swab, chest Xray, and blood tests. /r/n/r/n Treatment for an acute infection includes the at-home remedies mentioned above and medications for bronchitis. These medications could include /r/n/r/n Chronic bronchitis is not contagious, so you don't need to worry about exposing someone else to it. Managing chronic bronchitis differs from treating acute bronchitis and involves treatments to prevent complications and slow progression. /r/n/r/n Some management strategies include /r/n/r/n There is no cure for bronchitis. Instead, acute bronchitis must heal after a respiratory infection, and chronic bronchitis requires various management strategies. /r/n/r/n Chronic bronchitis recurs because the airways become permanently damaged and never fully heal. Swelling and tissue thickening may narrow the lungs. /r/n/r/n. In addition, damaged air sacs lose their ability to stretch and shrink back. Mucus in the airways can block airflow, making it difficult to breathe. /r/n/r/n. The best thing to do to prevent chronic bronchitis flares is to avoid the things that trigger them. Common triggers include /r/n/r/n. Bronchitis may be acute or chronic. Acute bronchitis resolves in a couple of weeks, while chronic bronchitis may last for months and come and go. At-home therapies and medicines can help reduce the symptoms of bronchitis. If your symptoms do not resolve within 3 weeks, it's time to see a healthcare provider. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.